What, if any, role did prescription drugs play in the death of Whitney Houston? Was she one of millions of Americans who misused or abused her prescribed medicines? Are you aware of just how dangerous prescription drugs can be if not taken correctly? Well, we're going to tell you more about that right now on It's Your Call. As the world mourns a superstar and awaits official word on the cause of her death, questions about possible drug use or misuse of prescription drugs abound. Did they contribute to Whitney Houston's death, or was it just a tragic accident? Hello, everyone, and thank you so much for joining us. I'm Lynn Doyle. You know, there's been a lot of speculation about the cause of Whitney Houston's untimely death, but as of right now, when we are doing this show, we don't know with any certainty whether drugs, legal or otherwise, played a role. What we do know is that authorities are seeking answers from doctors who prescribed her the drugs that were found in her room. And we also know that, as with every tragedy, there's an opportunity to learn from it. So this hour, we're going to take a look at prescription drug use in this country, the dangers that are associated with it, and the common mistakes that people make every day that could be deadly. Joining us to provide insight and guidance on this topic is Dr. Jeremy Frank, who is a licensed psychologist and certified addiction counselor who has a private practice in Philadelphia. Dr. Frank, thank you so much for being with us.
It's great to be here.
I understand that in this country, prescription drug use is at an all-time high. Why is that? Is there any particular reason why Americans are using so many prescribed meds?
Probably the innovations in the pharmaceutical industry have made people more aware of these medications and more aware of the illnesses that they treat. So people ask their doctors, and the advances in pain management have been really beneficial to help people in the end of life and to help people after surgery. So for the most part, these are benevolent reasons that are helpful to people.
I actually read somewhere that something like 48 million people over the age of 12 say at some point in their lifetime they use prescribed drugs. That sounds like an enormous statistic to me. Are you shocked by it as someone who deals in this field?
It's about 20% of the United States population. My understanding is about 1 out of every 2 children will use a prescription drug in the past month, and about 9 out of 10 adults will use a prescription drug also.
See, those numbers just absolutely startle me. But the White House released a study that said that in the last decade, prescription drug misuse or abuse had seen a rise of something like 400%. You're not really surprised by that, are you?
I think over time, drug and alcohol use has probably stayed about the same. The Greek philosophers used to complain that the boys, the men who were their students, used to drink too much wine, so people would complain about kids today. So I think that these drugs go in and out of vogue depending on the times.
Okay, but there are specific types of prescription drugs where people have more difficulty than others. We're not talking about, you know, some of the daily things that people take to keep their hearts beating, or, you know, their blood pressure down, or their cholesterol. We're talking about 3 different areas. It's painkillers, anxiety drugs, and stimulants. Let's talk about what each one of those involves. Like painkillers, for example. What might a common painkiller be?
Painkillers are Percocet, Percodan, Darvocet. OxyContin is one that's in the press a lot, and they're used for surgery, to manage pain late in life, and for dental procedures. And then the benzodiazepines are Xanax, Valium, Ativan, and those are used to treat panic and anxiety. Those are probably less abused. The mental health treatment drugs are less abusable but still very addictive than the pain management meds. And then the other class would be stimulants like Adderall and Ritalin.
And that's what we hear that kids sometimes misuse or are addicted to.
Sure. Yeah. Oftentimes it starts with a prescription, and then people feel that these drugs are safe because a physician prescribed them.
Right.
My grandmother takes Vicodin, or a friend takes OxyContin, so it must be safe. But in small doses, these drugs are safe, and if they're prescribed for a short term and medically monitored. In larger doses, any drug is a poison and has side effects.
Dr. Frank, we're going to go to the telephone lines now. We are joined by Linda. Linda, it's good to have you with us.
Thank you.
Now, do you have a personal experience with prescription drug misuse or abuse?
Yes, I do. My youngest son. He's 26 years old now.
Okay.
When he was almost 19, he had a terrible accident with his foot. It was turned around completely backwards. The ankle was fractured. He had to have immediate, emergency surgery. They had to put a plate and 9 screws in his ankle. The orthopedic doctor had told me that it was an extremely serious injury and he was going to be in excruciating pain. So he was pretty much laid up for almost completely for almost 3 months.
Oh, wow.
And during that time, my son was given prescription after prescription of
Oxycontin. Now, was that for the pain, to try to manage the pain?
That was for the pain.
Okay.
When it got to a little over 3 months, I had called the doctor and told him, I believe my son is getting addicted, becoming addicted to these pills. Mm-hmm. And, of course, he told me, well, he hadn't been on them that long. He could not be addicted to them. And because he was over 18, so nothing I said seemed to matter.
Well, let me ask you something, Linda. What made you think that he was getting addicted to it? Was his behavior changing, or was he just, watching the clock for every moment, or, just couldn't live without the idea of taking the pills?
Well, I know that he was in an awful lot of pain, but I seemed to think at the time that he was taking them to kind of knock himself out so he didn't feel the pain. That the pain was that excruciating that he just didn't want to be awake.
So you said that this happened several years ago, and yet now he's in his mid-20s. Is he still struggling with the addiction? Yes.
He has struggled ever since to stay off of this kind of drug. It got to the point where he couldn't keep a job because he couldn't pass a drug test because he was constantly taking these kind of drugs.
Right.
He would lose a job because he was taking these kinds of drugs. When he wasn't working, he ended up getting in trouble because he didn't have money to buy the pills, so he would get in trouble to get money to buy the pills.
Let's bring the expert in here, Linda, and maybe we can help you and your son and others who are watching out. I mean, does this story sound typical to you, Dr. Frank? Have you heard this before?
Yeah, very often on a daily basis, people come into my office and they were prescribed drugs for pain, and oftentimes physicians are not trained adequately in addiction medicine. There are addiction psychiatrists and there's addiction medicine, but most physicians generally are not trained in identification of addiction. And I have patients who will say that they told their physician that they were concerned, yet the physician would prescribe medicine anyway. Now, it can be done safely if one is honest with their physician and it's for a short amount of time, and especially if someone's in therapy and they're seeing an addiction psychologist or somebody else, that the physicians, the treatment team are talking. What
if someone like this woman's son doesn't have insurance, can't get addiction counseling? I mean, what can we do to help?
Without insurance, that's tricky, but the city and states have programs that people can call as Medicare and medical assistance. You can also call some of the treatment rehabs locally, and they can help people through the process. And entry also could be into a hospital, but AA is everywhere, and NA, Narcotics Anonymous.
Right.
There are meetings on a daily basis all throughout the day.
So Linda, really there's some suggestions for you, but as we go to break here, would you say that using those prescription drugs or having that experience has altered your son's life forever?
I'm hoping that that's not the case, but I don't know. It could very well be the case. He struggles daily. He does go to NA, which is an extreme amount of help for him.
Good.
I just have to, I'm not losing faith that he's going to be okay.
Well, we certainly will hold him in our thoughts and our prayers, and we thank you for sharing your story so that first you tell people out there that they're not alone in suffering with this, but then also by saying that there is hope that you can get through it. So Linda, thank you so much. I appreciate it.
Thank you.
If you or someone you know is using prescribed drugs, you might want to pay close attention to our experts' advice just to be sure that there's no misuse or even abuse going on. Dr. Jeremy Frank is my guest, and he's going to answer some frequently asked questions about prescription drugs or possible addiction. Now, we put the question up on Facebook, and one of our viewers wrote in, what are some of the common signs that someone might be becoming addicted to a certain drug? My mother is 78 and freaks out when she thinks she has to go to sleep without taking Ambien.
Yeah, well, we look at the various areas in one's life of adaptive functioning. So socially, is she having difficulties? Interpersonally, with relationships, occupation, work, career, school? Are there legal problems? Is somebody doctor hopping or doctor shopping? And also withdrawal and tolerance is something that family members can recognize as well. So withdrawal is that when someone is not using the substance, are they angry or irritable or sleepy, overly energetic? And then tolerance is the process where people need to take more of the drug to get the same effect. So people are either taking more of the drug, they're taking a stronger drug, or they're taking it more frequently. So oftentimes family members can witness that.
Well, can you clarify what might be a misconception? If you take a drug long enough, can your body become accustomed to it and it literally does not work as well as it initially did?
Yeah, that's tolerance.
Tolerance?
Now, some people believe that there's a genetic predisposition, and this has been shown, towards addiction. So about 5% of the population may inherit from family members a predisposition towards addiction. And if there's a family member who has an addiction, then you're 4 times more likely to have an addiction than the next person, which is about a 20% likelihood that you can become dependent. However, with these drugs, you can become dependent on them even if you don't have a genetic predisposition.
You know, people who have watched the show for a very long time remember that I broke my leg and had a very serious knee injury, had to have reconstruction and everything, and they gave me Percocet, which I guess is a typical painkiller in a situation like that.
Sure.
I was so uncomfortable on that drug, even though it did help with the pain, because I felt like I was always having an out-of-body experience. But I could see where people could get addicted to the idea of getting away from the pain. I mean, mine was, you know, in hindsight, a relatively simple procedure to get through. But do people realize that they can get addicted, or is it too late by the time we've figured it out?
It absolutely sneaks up on people. No one says that they thought that they could become addicted. It's as if you're accelerating towards a cliff at 80 miles per hour and you say, I'm going to stop when I get there. No one's able to do that. They're usually going over the cliff and they're wishing that they had stopped, or they hit the ground and then they wish they stopped.
Right. We're going to go back to the telephone lines where we are joined by Frank now. Frank, thank you for being with us.
Oh, you're quite welcome, Lynn. Thanks for the opportunity.
Certainly. You just heard our expert describe this feeling of like almost heading toward a cliff at 80 miles an hour. Have you had any experience with prescription drugs that you could liken to that example?
Yes, I can. And he is right. There is a genetic disposition. My mother was addicted to quite a few drugs as I was growing up. And but yeah, it wasn't so far as going off a cliff. It was going 80 miles an hour into a brick wall. And it completely turned my life upside down, backwards, and sideways in so many different aspects.
Were you addicted to prescription drugs as a result of an accident or an injury or an illness?
Actually, it was multiple injuries, multiple knee surgeries, multiple shoulder surgeries, degenerative disc disease in my back. That I still suffer with today.
So how long were you addicted to the prescription drugs?
24 years.
Oh my gosh. Seriously? 24
Yes, seriously.
years. How were you able to get drugs for that long? I mean, a doctor wasn't prescribing them for you for 24 years, was he?
Some doctors were, and it's just like the expert that you have on the radio now. I went doctor shopping. And it's not all that hard to do for some people if they know their signs and symptoms verbatim every time they walk into another doctor's office or a hospital emergency room. they can get whatever they want.
Well, let me ask you this then very quickly. After 24 years, are you still addicted to prescription drugs, or have you been able to wean yourself from them?
Absolutely. I'm 17 months clean and sober.
Oh, wow. We don't have enough time for you to tell me how you did that, but can you give us the succinct version? How were you able to finally get off it?
Actually, it was kind of being in the wrong place at the right time. God intervened with me. I got arrested. And I did a couple weeks in the local jail out here in California, and it cleaned me up and made me see the light.
And sometimes that's what it takes, right? Hitting rock bottom.
It does.
Right.
It does. When you hit bottom, it hurts.
So what you're saying to people
around you
is that you can do it. You just, hopefully you don't have to hit rock bottom, but it can be done. You can get off of them. Is that what you're saying?
Absolutely.
All right. Frank, thank you so much for sharing your story and being an inspiration, and we wish you the best of luck with your continued recovery. I know the addiction experts here will tell us that this is not something you have to you will be dealing with it for the rest of your life. So we wish you the best of luck with it.
Thanks, Lynn.
Thank you. Sam says, is it true that more people die from prescription drug overdoses than in automobile accidents? Have you ever heard that?
I think that that's true now. I know that more people are dying from prescription drug overdoses than heroin and cocaine combined.
Wow. How do you recover? How do you ever come back from a prescription drug addiction?
A good entry point is to start with an addiction psychologist or addiction psychiatrist or a drug and alcohol rehab. And then you do a stepped up level of care approach. So you start out with maybe once a week therapy. It needs to be broad and diverse. Usually group therapy is a component, and then 12-step programs or other sorts of social support. Addiction is the tip of the iceberg. So there are 9/10 under the water that you want to get curious and hungry about. That may be medicating a depression or anxiety. It may be that someone's angry at their family. It may be insecurities. And oftentimes it has to do with difficulties with relationships. And people use drugs to mediate their relationships.
And can it be as simple as a physical addiction?
Yes.
Yes,
it can,
sometimes it's just
of course.
physically. You just get addicted to it, and you have to fight through that as well. These are some of the warning signs and how we can help. You say talk to the individual, tell them why you're concerned, provide a resource to help, and then allow that person to get involved.
Yeah.
Anything that you can add to that as we close out here?
You beg, you cajole, you convince. It doesn't have to be with ultimatums or tough love or consequences. And you do your research and you provide them with some options, and you tell them that you love them, and you don't do it while you're drunk or you're in a fight, and you try to get them help any way you can. In Al-Anon, they'll say you didn't cause it, you can't control it, and you can't cure the problem. So there's only so much that you can do, but you can certainly try.
Well, thank you so much for giving us a piece of this puzzle to examine and to explore, and tools with which to work with in case we suspect there is a problem. Dr. Jeremy Frank, thank you so much.